Welcome to Your Source TV. From the nation's capital, be empowered to think outside the box. I'm Tamara Stuchlak, and in this segment, we explore a new medical model for personalized medicine called Concierge Medicine. With us is Dr. Sandy Ibrahim. She's a specialist in family medicine, and she's a principal with Partner MD with her colleague, Dr. Mark Pastor. Dr. Ibrahim, thank you so much for being with us.
Thank you for having me. It's a pleasure.
Let's jump right in. What is concierge medicine?
Concierge medicine, there's a couple terms for it. Concierge certainly being one of them, boutique medicine, membership medicine. The general concept is going from traditional medicine, which is a practice of about 4,000 to 6,000 patients for 2 to 3 doctors, where you see traditionally 25 to 30 patients a day. Concierge medicine takes that down to 600 patients per doctor, where the average day for a doctor is maybe anywhere from 6 to 10 patients. So concierge medicine is fewer patients for the physician, longer visits for the patient, more personalized health care in the sense that the doctor truly does know the patient at this point, much more proactive in their health care, really get a chance to be that patient advocate, spend much more time with your patient, so there's no questions at the end of the day of whether or not you've done everything you can for your patient.
So when did concierge medicine generally get started, this new industry?
Right. The concept was born about 10 years ago in Seattle, Washington, over on the West Coast, out of a need and out of a want for better health care. The health care system, as we all know as it is broken. It's driven by greed and insurance companies where doctors...
And cutting costs.
Doctors have to see 25 patients a day just to break even to keep the lights on, and then anything above that 25th patient will potentially pay the salary and make some money for the practice. So
over the last 10 years, doctors have been put in a box.
Absolutely.
And they cannot allow their patients that time frame of more than, 3 to 5 minutes.
The average, I understand, the average office visit in family practice for a patient encounter is about 6 to 8 minutes. The average wait in the waiting room for the patient for that 6-minute encounter is about 30 to 45-minute wait.
So given that that's what patients were experiencing,
Yeah.
A new model, and this model is a membership model.
Right.
So what does that mean?
So for a doctor to afford to see significantly fewer patients, again, I had 6,000 patients in my previous practice between 2 doctors. To be able to go from 6,000 patients to 600 patients, we take that cost and we pass some of that on to the patient. So there's a membership fee. It's an annual membership fee to be one of those 600 patients. So that way we can focus more of our attention on you as opposed to seeing more patients to keep the lights on.
And in the industry, there's an approximate range for that fee, somewhere between $1,500 to $1,800. But then some practices don't accept insurance. So
Right.
Let's talk a little bit about that, because this is all new information for the consumer.
There are different types of boutique medicine, certainly. There are the types of boutique medicine that is born out of the frustration of a doctor. So a doctor in his or her older years, about to retire, wanting to taper down their practice, saying, I can't keep up seeing 30 patients a day. I can't keep up seeing 35 people a day. Let me cut down my practice, charge some money, and then they figure out what that fee is. There are some practices born out of certainly greed, where the physician wants to make more money. Our particular practice, Partner MD.
And there's always been elite medicine.
Sure.
In LA.
Oh, sure. There's private physicians, the doctors that fly around the world with their princes and princesses. Our particular practice was born out of the frustration of a patient. So the entire concept of Partner MD is really about customer service and care from a patient's perspective, not so much from the doctor's perspective.
So there's no waiting in the waiting room.
That's the idea. So there's absolutely no waiting. If there's waiting, it won't be longer than 5 minutes.
Do your patients believe it when they first experience their membership?
They are quite pleased, that's for sure. And the biggest thing about concierge medicine, particularly Partner MD, is it's not about marketing, it's about word of mouth. Once you have that experience, it just kind of blossoms from there. And again, we cap at 600 patients, and it's not very hard to get that.
And what brought you to concierge medicine? I know that you and Dr. Pasteur were practicing together
in
prior
traditional medicine
to Partner MD.
The concept for a physician is fabulous, obviously. You see fewer patients, you get to spend more time. That's a no-brainer. But certainly the idea of medicine, and I'm a family doctor, so the idea of being a family doctor, when I first said I want to go to medical school one day, by the time I came out of medical school and residency and started in the real world, it was significantly different than what the shiny brochure said it would be, for sure. I found myself on a treadmill. I found myself practicing urgent care more than anything, putting Band-Aids on people, and not literally, figuratively certainly. It's just trying to take care of the urgent matter at hand, and the preventative medicine, the counseling, was kind of put to the wayside because I didn't have enough time.
So that whole model of medicine, this generation has no idea that that's what it was supposed to be because they've never experienced it.
In my residency, as many residencies across the country, the top resident was the one who could see the most patients. Okay, they would measure your performance by how many office visits you had for the year.
So we've really gotten off track.
Well, it's an answer to what the system has done for us or to us. So in order to breed more doctors, they have to be the right kind of doctors who can succeed in this type of environment, which unfortunately is more about production as opposed to managing the patient.
So with Partner MD and a membership, Concierge Medicine, your patients can call you at any time. They have your cell phone and your email, and when they come in, they can have a 30-minute appointment, even if they only need 15 minutes.
Right, so the fun part now is that we have half an hour for the patient whether they want it or not. They can certainly leave before the half hour is over. Before, in traditional medicine, the doctor's hand was on the doorknob trying to get out there because they had some more patients to see, whereas now the patient's hand is on the doorknob saying, no, really, I have no other questions. So it's a very different world that we have. But yes, accessibility 24/7. The email is meant for non-urgent matters. The cell phone is meant for urgent matters. And people say, my God, you're 24/7, anybody can call you on your cell phone. Well, believe it or not, when you're on call in the traditional practice, 24/7, 6,000 people could have called me on my call nights. Right now, 600 people could potentially call me. And there are significantly fewer calls now that the patients have that accessibility. And the reason for that is there's no sense of urgency and fear anymore. We're taking that fear out of medicine.
Like I'm not going to be able to get through to my doctor or get an answer, and plus the not knowing about a condition.
Right. So
and how to treat it.
Patients are well informed. They know the side effect profile of the medicine I give them before they walk out the door. They know if they call Monday morning, they'll be seen Monday. They don't have to call me Sunday night saying, can you squeeze me in? There's none of that frantic Friday, 5 o'clock, nobody called me back today. We'll call you back that day. You shoot me an email, I'll get it right back to you.
You can basically call in and they can receive a prescription from across the country. You will get that prescription to them.
Well, depending on what it is, certainly okay, depending on what it is. Just this weekend, a patient of mine called from London. She said, I'm arriving in Dulles at 3 o'clock. Can you see me at 4 o'clock? I said, I'll be waiting for you. So fewer patients, you have that time. You definitely have that interest in that and that want, and you'll be able to see them when they need to. We do home calls. We do house calls as well. Of course, if they're medically necessary, I have a couple patients that I visit them exclusively in their home. They are not able to come to the office. It's the kind of medicine, and I say this all the time, that I thought I was signing up for when I went to medical school. I grew up in the Midwest. That was my concept of a family doctor, somebody who actually knew who I was, knew where I was coming from, knew where I wanted to go with my health and my life, and was able to get me there safely.
So I understand you have an interest in endocrinology, in allergies, in women's health, and preventive medicine.
Yeah.
So you're able now to incorporate that into your practice because of the model of medicine that
Absolutely.
you're practicing?
Actually, every one of our patients, we call them members, every one of our patient members starts off with a 3-hour physical exam. 2 of those hours are spent with a doctor and the nurse, and what we do is we take their entire medical history, we do a thorough exam,
You draw blood in the office?
We draw blood in our office.
Have people go to another facility?
No, you don't have to go wait in another facility, certainly. Hearing tests, vision tests. We take your entire medical history, and just to compare, in traditional practice, when you had your physical exam, you were scheduled for about half an hour. And in that half an hour, traditionally, you would have spent, you got to pee in a cup, you get your EKG, blood pressure, height, weight, that's already 15, 20 minutes there, and then you're left 10 minutes with the doctor who's taking your history while doing your exam, okay? Now I have half an hour to do my history, so I get to know your mental health risks, I get to know your accident risks, do you skydive, do you like to throw yourself over cliffs or things like that?
Your family history.
Family history without a doubt. And then we have half an hour that with a nursing assessment, hearing test, vision test, breathing test, heart test, another half an hour to do a physical exam.
Are you finding with this model versus what you and Dr. Pasteur were able to do prior to Partner MD, that you, in that first visit or first couple of visits, because you have the extra time, you're picking things up that you may not pick up until they presented themselves as a chronic condition? Or
oftentimes, certainly. I've had some patients follow me from my first couple of practices all the way through my career here in Virginia, and only now can I say, now I actually know you. So all those sleep problems that you had, and I kept writing those sleeping pills, turns out it was because of stress and anxiety, because of so-and-so, because of this or that. So when you really get down deep, you start to treat the problems and not the actual symptoms. So, without a doubt.